The honourable member for Dartmouth South.
My question is for the Minister of Health. Mr. Speaker, many people in Dartmouth are worried about the future of healthcare in their community. Before the new year, 4 local family practitioners are scheduled to retire in the Dartmouth area. Their absence will leave approximately 10,000 residents of my constituency and those of others in this House without a primary care provider. Many residents of Dartmouth are senior citizens with complex healthcare needs. They cannot use a walk-in clinic, and they cannot wait years for a new doctor to be recruited. Dartmouth also has a substantial proportion of low-income residents and other population with high medical needs. Would the Minister of Health agree that this situation is cause for alarm?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. As the member notes, her community having concerns with access to primary care. That would be the case, as I've said before, with people from across the province and communities across the province, whether it's in Cape Breton, in Dartmouth, in the HRM area, or down on the South Shore, and points in between. That's why, Mr. Speaker, we've committed to increase the resources, the investments to recruitment of primary care professionals to support our communities, provide those care services to the people of Nova Scotia to ensure they have the primary health care that they need and deserve. Thank you.
The honourable member for Dartmouth South.
Thank you, Mr. Speaker. I'll start by saying that it's been acknowledged by Doctors Nova Scotia and others that Dartmouth may be in the most critical situation around family physicians at this moment. So I would ask the Minister just to focus on Dartmouth specifically, if we could, for a moment. Mr. Speaker, the 10,000 people I referred to are only the latest to join the ranks of those waiting for a family doctor. Already facing a doctor shortage, a wave of retirements is hitting the Dartmouth community. 33 of our 71 primary care physicians will retire within 5 years, leaving almost half of over 100,000 people in the catchment area of the Dartmouth General Hospital without a family physician. I'd like to ask the Minister of Health and Wellness, when will people in Dartmouth see new doctors?
The Honourable Minister of Health and Wellness.
Thank you. Thank you, Mr. Speaker, and thank the member for the question. As the member would know, part of the recruitment process does focus on working with physicians for those physicians to have the flexibility to choose where they practice when they come to Nova Scotia, Mr. Speaker. So we're not in a position to explicitly state when the individuals will choose. We can't provide that direction, Mr. Speaker. That process was attempted by the NSHA to provide direction and require physicians to practice in a particular location. That's been deemed not the appropriate process. So we continue to have recruiters through the NSHA on the ground working to attract physicians to sign contracts to provide services to Nova Scotians in Dartmouth, in Digby, in Cape Breton, and all points in between, Mr. Speaker, all across the province. They continue to work with physicians, nurse practitioners, and other healthcare professionals.